Legislation to legalise medical assistance for terminally ill people who wish to end their lives will be published at Holyrood later. Two previous attempts to change the law on assisted dying were decisively defeated. But the Liberal Democrat MSP Liam McArthur, who's introducing this bill, says he believes the political mood on the issue has changed. Well, Gillian Wright is a former palliative care doctor and is part of the group Our Duty of Care, which is against plans to legalise assisted suicide. Good morning to you, Gillian. Thank you very much indeed for joining us this morning.
Good morning. Thank you.
Just outline the main reasons for your opposition to this sort of bill.
Well, thank you. Yes, doctors across Scotland have huge sympathy for those who suffer at end of life, and we would campaign for the best palliative care for them. But we're really concerned that any move to legalise assisted suicide would adversely affect those who are particularly vulnerable. So those with chronic mental health problems or learning disability, those who are homeless, and those who might feel a pressure to take their own life. This is the wrong intervention at the wrong time. The NHS is in crisis and palliative care lacks proper funding.
Isn't medical assistance, though, with safeguards in place, better for everyone rather than those who are perhaps already having to deal with the mental stresses and strains of dealing with a terminal illness, worrying about how they might try to end their own suffering?
Absolutely. We take on board that it's hard for those who are anxious, and we would really campaign for real investment in specialist palliative care. So about a quarter of patients across the UK don't get the palliative care that they need. And that's both physical symptoms and psychological symptoms, because there are a huge amount of things that need adjusted to when you're given a terminal diagnosis. And we're really concerned this is not just for exceptional cases, as perhaps might be described. About a quarter of patients coming into any Scottish hospital are in the last year of life. So this actually affects a significant number of patients and families, and we need to get it right for them.
It's a group of a group of MPs has also been looking at this at Westminster. They examined provisions on assisted dying in other parts of the world, and they reported that palliative and end-of-life care hasn't deteriorated in those countries, and in a whole lot of other countries it's actually improved. So is there an argument there to say that if we improve choices at the end of life, palliative care could improve as well?
That's it's when you look at individual countries, the data is not convincing. I think sometimes there can be an investment at the time when a law is passed, but what we do find is that there are problems when these kind of laws are introduced and palliative care doesn't keep up. What we really want is for real investment, not just in palliative care, but in social care, because we're concerned particularly for those who are elderly and who might have a wish to die. One of the really concerning things in the bill as announced this morning is that there's only a 2-week reflection period, and that's not enough time to get psychological services or a referral for psychological support. It's not enough time even for an antidepressant to work. So we're really concerned that this is premature, moving towards taking your own life, and supported by the doctor, helped by the doctor to do that. It changes the doctor-patient relationship. Patients need to know as they come into hospital that they can trust their doctor and that the doctor won't kill them.
You mentioned there needs to be an investment in social care for the elderly. We need to make specific, though, this is for people who have been diagnosed with a terminal illness. It's not just for people who are old.
Absolutely. But what we've found in other countries is that even when, for example, in Canada, it was proposed for as a narrow bill for those who are terminally ill. It was immediately challenged in the Canadian courts by an elderly lady who had chronic arthritic pain, and she argued that her case was as valid as others, and the Canadian law was extended to include those who have a chronic disability and who were suffering also on grounds of equality legislation. And actually, even more worryingly, it was extended to those who have chronic mental illness. And that has only been paused because of international outcry. So these safeguards are actually eligibility criteria, and they can be dismantled very easily.
Are you losing this argument with the public? There's a poll has been, it's on the front page of the Scotsman today, saying 78% of the public agree with assisted dying. I wonder whether palliative care consultants are losing this argument.
I think it's a very natural thing when people are asked if they would want any suffering at the end of life, that people would say no, none of us wants to see anyone suffering at the end. I think what's really concerning is the use of the word assisted dying. What we actually mean is assisted suicide, and many people have been found in polling that they don't necessarily understand the implications of that term. Some think it means palliative care, some think that it means stopping treatment, some think that it means DNA CPR. So absolutely, we need to listen to the public, because they are telling us that they're not getting the care that they need. And I'm grateful that palliative care is on the news this morning, because we need to rethink how we fund it, because there are patients up and down Scotland who don't get the care they need. And
to be fair, I think there are people on the other side of this specific issue who would agree with you. I wonder how many palliative care consultants you've spoken to about this, and how many you think support it or are against it.
Well, there was a survey done by the Association of Palliative Medicine just of specialist palliative care consultants in Scotland, and they found that 95% of specialist palliative care doctors, so consultants, registrars and specialty doctors, were against this. So 95% would not do it, but also 40% would leave their job if this was brought into their hospital or hospice, and 20% would not train in Scotland. So there's very clear opposition from palliative care. And interestingly, you can look at their work to see how they thought that it would damage palliative care and the implications, particularly for those who are vulnerable, that they looked after. Absolutely, we want to look after and care for those who are suffering. And absolutely, we don't want people waking in the night. But the problem is that people are not getting 24/7 care. They may get access to specialist care during the day, but they don't get it overnight and at the weekend.
Gillian, we must leave it there with you. Gillian Wright, who's a former palliative care doctor and part of the group Our Duty of Care, which is against these plans to introduce assisted dying, or assisted suicide, as she calls it. Thank you, Gillian, for joining us.